My name is Matthew Kearns. I'm a registered nurse. My patient is Amanda Kearns, a consenting adult over 18. This video is going to be the head, neck, lymph nodes, and respiratory and cardiac assessment for Ohio Christian University. I'll start by washing my hands and introducing myself. Hi, how are you doing?
Good.
At first, it's going to be a little bit of overlap from the previous video. I'll start by examining the head. Again, I want to make sure there's no lesions, moles, rashes, or wounds or anything. Again, some dry scalp back here in the back. I want to assess the neck while I'm right here. You tilt your neck back. I want to look and make sure the trachea is midline, not shifted to either side. You can tilt your head back. Turn your head to the left, to the right. I'm looking for jugular vein distension. Let's turn back to the center. I'm going to look at the thyroid. Looks okay. I'm going to make sure it's not swollen. I'm going to go ahead and palpitate the head. You tell me if there's any tenderness anywhere, okay?
No, there isn't.
Okay. Now, I'm going to look at the lymph. I'm going to palpitate your lymph nodes. Lymph nodes, you'll notice, will be swollen or tender sometimes when there's an infection. I'll start back here and go to the occipital. Any tenderness here?
No.
I'm going to come down to submandibular. I'm going to go to the cervical. Supraclavicular and mid-sternal. Any tenderness anywhere?
No.
Okay, good. Okay, so the next part, we're going to go ahead. Before we do a cardio or respiratory assessment, I'm going to ask you a few questions. Do you use home oxygen at all now?
No.
Are you currently having any trouble breathing?
No, I'm not.
At rest or maybe when you're moving around or anything?
No.
How about heart abnormalities? Do you have a murmur or anything? Or a pacemaker maybe?
No.
Okay, so I'm just going to examine the chest. I want to make sure there's nice, even rise and fall. I want to make sure it's a 2-to-1 ratio, that there's no barrel chesting or no use of accessory muscles. We'd see those down lower. So before I auscultate anything, I'm going to palpitate using tactical fremitus. It's vibration transmitted with voice through areas of consolidations, and sometimes this can indicate fluid filled lungs and chest cavities. So I'm going to put my hand here. Every time I touch and say 99, I want you to repeat. 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
And you would do this both, I just did it posterior, but you're going to want to do it anterior too. 99.
99.
99.
99.
And watch around breast tissue because it can give a false. 99.
99.
99.
99.
Next, we're going to percuss. When we percuss with resonance, we'll hear normal lungs will have a resonant sound due to presence of air. Dullness or flat can indicate fluid or soft tissue. So I'm just going to use 2 fingers and tap, okay?
Okay.
Now I would also repeat and do this to anterior. Next, I'm going to auscultate your lungs. I'm going to listen to your breath sounds. I want to make sure there's no wheezing, rubs, crackles, or rhonchi, okay?
Okay.
And just breathe normal. Breathe in. And you want to allow for a full inspiration and expiration. And also, again, do posterior. Also with lung expansion, if you don't mind just turning a little bit that way, you can take your hands like this, and when you, I'll do,
Oh,
when you take
okay.
your hands like this, I'll put them on your back. When you breathe in, breathe out, I'm looking for normal expansion. Breathe in. Yeah. That was normal expansion. So you can just turn around. Lastly, I'm just going to take a listen to your heart to make sure there's maybe no murmurs or anything you didn't notice. Just make sure. I'm looking for the fifth intercostal space. And we're listening for a normal S1, S2, which you did have. And that concludes our video. Thank you.